This is Dr. Anthony Colantonio, and this video is about two types of common and deadly infections that are found inside the hospital. Number one, MRSA, also known as MRSA, methicillin-resistant Staphylococcus aureus infection. This is a type of staph infection that is resistant to the common types of antibiotics and very difficult to kill and is very contagious. MRSA is one of the most common hospital-acquired infections. Surveillance for MRSA in hospitalized patients and hospital staff is very poor or non-existent. The United States has very high infection rates of MRSA. In countries that have low MRSA infection rates, their success is due to two factors. Number one, the very limited use of antibiotics, and number two, the use of surveillance for their hospital and their medical staff. In the United States, physicians prescribe too many antibiotics. The next time you have signs and symptoms of an infection, you should ask your doctor if the infection is most likely caused by a virus, and if so, ask that a trial of watching and waiting be undertaken before antibiotics are given. Antibiotics not only increase the risk of MRSA, but also increase the risk of other antibiotic-associated illnesses, such as skin rash, dry skin, abdominal pain, diarrhea, nausea, bloating, and vomiting. Hospitals do not perform surveillance of their staff members, even though many of them are exposed to MRSA on a daily basis. They are contaminated with MRSA every day and carry it back and forth in and out of the hospital. Most staff members do not follow proper protocol and contaminate themselves, thereby contaminating other patients and their visitors. Hospitals don't test the physicians and nurses and other staff members for MRSA carrier status, even though it is a simple, painless, and inexpensive test done with a small cotton swab specimen taken from the nostrils. If this surveillance would be performed regularly, the MRSA incidence would be greatly reduced. The next time you are in the hospital, ask your nurse or your doctor if they have been tested for MRSA carrier status, and when was the last time they were tested. If they have taken care of MRSA patients since they were last tested, ask that they be tested again, and that they not care for patients until their negative status is confirmed. If they are carriers, they must be treated so that they do not transmit the bacteria to others. If they have never been tested for MRSA carrier status, then ask for another nurse to be your nurse or your loved one's nurse. Don't allow a nurse or a physician who hasn't been tested for MRSA carrier status to touch you or your loved one. Be sure the room has been cleaned since you arrived, including the bathroom, chairs, tables, doorknobs, TV control, bed control, the strings that control the blinds, the windows, the windowsills, all of the countertops, bed rails, and especially the drapes that separate the beds in a multi-bedded room. Those drapes are the dirtiest things in a hospital, especially if they are not changed every day and between patients entering the room. These are the spots in a hospital room that are most infected, not only with MRSA, but also with E. coli, the bacteria in your bodily waste, and other bacteria found in other bodily secretions. If possible, do not go to a hospital to have your surgery. If your surgery requires less than 12 hours of care, do not have that surgery in a hospital setting. Hospitals are very, very dirty. Ambulatory surgery centers are cleaner and have fewer infections. Another way to reduce the infection rate of MRSA is simple hand washing. Clothes, especially lab coats, carry bacteria from one patient to another. Ties carry bacteria from one patient to another. Shoes carry bacteria throughout the entire hospital and cause colonies of bacteria to start growing everywhere they walk. The best advice I can give you is to stay out of the hospital, and don't be afraid to speak up and say something. The life you save may be your own. Call the patient relations department if you have to. Call hospital administration if you have to. Call the local and/or state Department of Health if you have to. Call me. I'll get involved, and I'll help you be sure you don't become an infection statistic. The second type of infection that is very common and very dangerous and very contagious is called C. diff infection. The complete name of the bacteria is Clostridium difficile, also known as C. diff. And it is a bacteria that is very dangerous and, unfortunately, a common hospital-acquired infection, which can cause life-threatening illness. It is highly contagious and can easily be spread by hospital staff and patients in acute care facility, like a hospital. The increased risk of C. diff infection is also due to increased antibiotic use. Like MRSA, there are many different strains that have evolved, and if we continue to use the strong antibiotics that we are using and the amount of antibiotics we are using, the epidemic of MRSA and C. diff will get worse and worse. The other risk factor for C. diff is the use of medications to reduce the amount of stomach acid. Physicians use too many antacids, and this increases the chance of C. diff infection. In addition, poor hand hygiene also contributes to the spread of infection from patient to patient and from visitor to patient and vice versa. There are ways to help you prevent an MRSA or a C. diff infection. The following are ways a patient, their family members and visitors can take an active role in their health care and prevent hospital-acquired conditions and infections. Hand washing is, of course, the number one thing patients and visitors can do to help stop the spread of MRSA, C. diff, and other infections. But there are many more. There are some tips I would like to share with you on how to prevent MRSA and C. diff infection. So let's go to our slide. Number one, ask the hospital to have you screened for MRSA, especially if you are having surgery. The screening test is painless and simple and requires a small cotton-tipped swab to take a sample of the fluid around the end of your nose. Number two, scrub your body with an antibacterial soap or prescribed solution before having your surgery. Number three, confirm that the hospital uses checklists for surgery and that the checklist includes identifying recent infections. And also be sure that those checklists are used repeatedly from the time you check in, then again in the holding area before going into the operating room, then again inside the operating room before undergoing anesthesia. Most hospitals read the protocol after the patient is put under anesthesia, but you should demand that the checklist be read an additional time before you go to sleep so that you may listen to what is going to happen. Once you are asleep from anesthesia, it may be too late and a mistake might happen. Number four, if your procedure is under 3 hours, demand that the same anesthesiologist start and finish the procedure and the same nursing team start and finish the procedure. Your surgeon doesn't switch in the middle of the procedure. Why would you want your other doctor in the room and the nursing staff to switch? This will reduce traffic inside your operating room and will reduce infection and cross-contamination. Problems arise when the team switches, and you may demand that whoever starts the procedure finishes the procedure. Number five, always make sure everyone, including your doctor and visitors, wash their hands when entering the room. Remember, alcohol and alcohol rubs do not kill C. diff spores. Soap and water is best for washing hands. Number 6, if you have a urinary catheter in place, make sure it is removed as soon as possible. Number 7, if your loved one is on a respirator, insist that the respirator be removed as soon as medically possible. Number 8, make sure your room is clean. Make sure the bathroom is cleaned with bleach or a similar type of chemical that kills spores at least once during the beginning of the day and every day. If it is not done, insist that it be done and be done daily. Make sure your room is cleaned every single day. Number 9, make sure there is adequate nursing staff and adequate anesthesia staff. Nurse to patient ratios and adequate nursing staffing are very important to your health, your safety, and to your life. Ask your nurse if she is overworked and how many patients she is caring for. If your operation is after 3 p.m., ask your anesthesiologist if they have been there all day. If so, ask for another anesthesiologist to come in and provide you with your anesthesia care. Demand these things because it will save your life. In addition, you must speak up and complain when you see someone violating the rules of isolation or not washing their hands properly, which is something that happens regularly in the hospital. You and the entire community are better off complaining to the local or state health departments than complaining to the hospital. Don't expect your nurse or physician to complain because it is becoming more and more difficult for healthcare workers to speak up. Patients and family members must start to advocate for themselves while in a hospital. With the soon-to-be extinction of the private physician in the near future, your physician will soon become an employee of the hospital instead of your private physician. This will create a conflict of interest, especially one that will inhibit patient advocacy. In hospitals, the private physician must be careful not to disturb the corporate mission. As an employee, the physician will protect the entity that signs their paycheck before they protect you, the patient. Patients are left to protect themselves, and this website will help you. Public reporting of hospital-acquired conditions and hospital-acquired infections should be mandatory in your state, if it is not. Increased transparency and public reporting of healthcare-associated infections is an important part of a comprehensive effort to prevent healthcare-associated infections and eliminate these infections. Thank you very much for visiting our website, and please feel free to follow all of the links to help educate yourself and protect you from injury and protect you from infections. If you have any questions, please call me. Call me on our toll-free number, 855-832-5757. The call is free. The advice is free. Call me now if you'd like. And please remember to ask for me. Ask for Dr. C. Thank you very much.